And we're recording. Hi, welcome to the Generations Brown Bag webinar. This is a lunch webinar that we do on the third Wednesdays of the month, and I thank you for joining us. This is being recorded, and this will also be posted then on our generations808.com site so that you can play it back at any time, whenever you like, and also you can share it with anybody you like as well. That goes for our radio show as well. So we have a radio podcast that airs, that you're probably aware of, but it airs on Sundays from 8 o'clock to 9 o'clock. Percy does a lot of those. Whenever Percy's not available, I step in, and sometimes we co-host together. And we've had some incredible guests on that as well. We've been doing these webinars, I believe we started in December. And so we've got a few really good ones that are already recorded. And today we've got a great one for you. So Cardax. We're going to talk about your inflamed joints and health and all kinds of stuff here with two of the experts from Cardax here. And I'm just going to let them go ahead and get it started. So we got Randal Mao and Dr. John Ruckles who are going to walk us through this. I'd like, if you have questions, we'd love it if you just put them in the chat or the questions and answers box, and then we'll probably get to them at the end. Well, we will get to them for sure at the end. If there's something that pops out that I think I want to ask before we get to the end, I'll go ahead and do that. So go ahead, just put your questions in there, and I'll ask them for us as we go along. Let's make sure we get everything answered that you want to have answered, okay? So Randy, with that, I'm going to have you take it and run with it. It's all yours.
Well, thank you very much, Rick, and thank you very much to Generations Magazine and to our general public audience that are here today. It's great that Generation Magazine could provide this great opportunity and platform for companies such as Cardax and others to share on what they have that could improve the quality of life for the people of Hawaii, as well as the people throughout the nation. So on behalf of Cardax, we're going to be doing a presentation. First of all, Dr. Ruckles will be presenting the scientific portion of this presentation. Then I'll step in and I'll bring the audience to the final close and share with what Cardax has brought to the market. So today's topic is the importance of managing your inflammatory health, whether it's in joint, foot, cardio or cardiovascular, metabolic, liver, and mental health. And we also have some information about longevity and what this compound has done, which was discovered by the University of Hawaii. It is an introduction to a nature identical marine dietary supplement. And so with that, I'm going to provide you with a agenda for today's presentation. So we're going to start off. I'm going to be providing introductions and backgrounds. And then Dr. Ruckles will be providing the learning shared by our physicians. And what we have done is we've gone around the nation providing this type of presentations to the medical conferences, whether they were doctors of osteopaths, internal medicine, cardiologists, naturopaths, nurse practitioners, physician assistants, and what they've shared in inflammatory health and the important findings and studies, which Dr. Ruckles will also be sharing. Dr. Ruckles will also be providing insights on current approaches to managing your inflammatory health and the long-term safety use of these approaches. Down the line on the agenda is, what is this natural occurring marine compound called astaxanthin? And Dr. Ruckles will provide a deeper dive into this. I will then come in and provide the research and discovery by the University of Hawaii on longevity, and then also an approach with drug-free supplementation to manage inflammatory health. And then through these medical conferences, we will share what we have learned by doing this for now about 2.5 years, but we've been on the market for about 5 years. Okay. So let me give you a little background about myself, and then with Dr. Ruckles, and then also on Cardax. For my background, I spent almost 29 years in the medical pharmaceutical industries, with almost 2 decades in the pharmaceutical industry with a company called Pfizer Inc. And today people are current with Pfizer Inc., knowing that they are one of the 3 pharmaceutical manufacturing companies that have brought out and rolled out the vaccine for COVID-19. But Pfizer has really a significant pipeline of other products or drugs in various disease states, whether it's cardiovascular, metabolic, whether it's liver, whether it's eye, whether it's infectious disease, whether it's in HIV or vaccines. So there I spent, as I mentioned, almost 2 decades with Pfizer in corporate business as a contract manager. And I interfaced actually in over 23 disease states. From there, I retired and took on a position as a director of medical and business affairs in hyperbaric medicine for a company called in Hawaii, American Hyperbaric and Wound Care Center. So this kind of brought me to realizing that there's more to approaches in health, actually in medical as well, non-pharmaceutical or being drug-free. So that opened my eyes up. Hyperbaric medicine is working purely with pure oxygen. And then from there, also worked as a consultant and advisor for a medical marijuana company here in Hawaii, which led me to today as the Vice President of Medical and Business Relations for Cardax Inc. And that's where I am currently. With Dr. John Ruckles, he spent over 11 years of primary care medical practice experience and over 25 years in clinic pharmacology research. He's the alumnus of Loma Linda University School of Medicine, internal medicine residency, actually in the Mayo Clinic, Rochester, New York, Minnesota, I should say, in 1984. And he's also board certified in internal medicine. He has served as the principal investigator for over 350 studies and the medical director for clinical devoted to phase 1 studies in Tacoma, Washington, and Honolulu, Hawaii. He has provided consulting services for over 200 studies, and domains include both in the nutraceutical and the pharmaceutical worlds. He's currently a chief medical officer of Cardax Inc., but more of his time is spent as a principal with Pacific Pharma Group, which he has created. So now I'd like to give you a little background on Cardax Inc. Cardax Inc. is a biopharmaceutical life sciences and research company headquartered in Honolulu, Hawaii. Its journey began back about 20 years ago on the slopes of Aiea, and that's where Cardax had their labs. They are dedicated to the development of exceptionally safe, potent anti-inflammatories for foot, cardiovascular, immunity, I should say, metabolic, liver, brain health, and longevity. The CEO is David G. Wadamo. The COO is Dave M. Wadamo. Cardax has actually 29 issued patents, and the company personnel spreads throughout the West Coast, East Coast, and Hawaii. The board of directors are all from the pharmaceutical background, and the pharmaceutical scientists and advisors are as well on the West Coast and on the East Coast. Cardax Inc. is also publicly traded as a company, and the symbol is CDXI. And if you want more of the studies that Dr. Ruckles will be presenting on and more, and if you want more insights about the company, you can go to www.cardaxpharma.com, and the product, the compound, and the product that we will be demonstrating today or presenting today, you can go to www.xanthocin.com. So without further ado, I wanted to kick off this presentation by first showing you this short interview. We were asked, the CEO David Wadamo and I were asked by KHON TV2 and Living 808 if we would come on and share about Cardax and about Xanthocin. So with that, I'm going to kick off with this short video.
Here's something that you may not know. It's a connection between inflammation and serious health issues, including cancer and diabetes.
We talked with Cardax Inc., a biotech company, about dietary supplements to manage chronic inflammation.
We're talking today about the importance of managing inflammation and health and longevity, something that I've done many hours of research on, and a couple of the guys that know all about it is David Waddlemold, President and CEO of Cardax, and Randal, the Director of Medical and Business Affairs with Cardax. Thank you guys so much for joining us. We appreciate it. This is information that we definitely want our viewers to know about. So let me start with you, Randal. Can you provide us a little bit of background on Cardax and its mission?
Absolutely. John, thanks for having us here today. Cardax is a biotechnology, life sciences, and human clinical research company. It's publicly traded, actually. And its mission is to working with and researching on inflammatory health and helping patients and doctors to manage inflammatory health. 4.5, 5 years ago, they came to the market and launched this very intriguing, game-changing product to help people and patients and doctors managing inflammatory health. So to today, we are now in over 2,100 GNC stores and pharmacies and online as well.
Dave, it's widely understood that managing your inflammation and your inflammatory health is the key to health and longevity. Maybe a lot of people don't know this, but what role does inflammation health play in chronic disease?
Well, first of all, John, great to be here. Good to see you again. Appreciate that. And very interestingly, inflammation plays a very significant role in most chronic diseases. Things like cardiovascular disease, liver disease, joint health, Alzheimer's, cancers, even COVID. These are all driven by chronic inflammation that doesn't go away when it's supposed to. And so managing one's inflammatory health, looking to improve your own physical capability to address your internal inflammatory health is key to health and longevity, as you just mentioned.
So many people think, okay, ibuprofen, aspirin, naproxen, maybe even like a steroid shot, but these don't really treat it the way you need it to be treated, and it doesn't stand for a long time. Can you tell me a little bit about some of the important situations that this is not the case? These are not the drugs for you.
Well, those types of anti-inflammatories really have too many side effects to take on a regular, everyday basis. Your physician will tell you that, and that's just the case for a minute. But many people, because they get relief, at least from some pain, tend to overuse them at some danger to themselves. So the real key is to find a dietary supplement, and we're working on a drug version of this as well. But right now we have a dietary supplement version of it called Xanthocin that allows you to safely address everyday inflammation.
Okay, so tell me how that works, because Xanthocin has been around, like you guys have said, for a few years now. How does Xanthocin from Cardax address the unmet needs?
Xanthocin contains a compound called astaxanthin. It's what makes salmon pink and lobster red. But without it, salmon are really, they're smaller. They don't swim upstream as well. So that was really an important discovery on us, that really astaxanthin, even as a potent anti-inflammatory, is actually a nutrient as well. And so astaxanthin can be taken safely every day and still have robust or potent inflammatory health benefits.
Randal, let me throw it back to you for a second. I want to know why so many physicians actually embrace Xanthocin.
Part of our mission is to get this scientific information out to the healthcare providers and physicians. We strongly believe that a lot of patients will go to their physicians and ask about anything new that's out of the market, let alone supplementation. So for about a year and a half, we reached out to medical conferences here in Hawaii. We would also go and see physicians at their practices. And more than that, we extended ourselves by going nationally, and we went throughout the nation presenting at these various CME, which is continuing medical education conferences, doing presentations. And it was overwhelming to us to see. We were amazed to see the embracement that these physicians, healthcare providers, nurse practitioners, even naturopaths had towards this compound.
Well, we certainly hope so. We certainly hope that the message is getting out there. And if it has, that leads me to my final question: where can I get Xanthicin, and how exactly should I take it?
So we started off in Hawaii at the GNC stores, Hawaii. I think at that time there were about 21 stores. And it was about 4 months later where we went out national to the over 2,100 stores or 3,000 stores, GNC world nationwide. They're in the pharmacare retail pharmacies are at Straub Hospital. They're at Palimami Hospital, as well as Capilani Medical Center for Women and Children. So they are also actively providing Xanthicin for customers. You can also go to xanthicin.com, and that's www.xanthicin.com. XanthosYN.com. You can call 1-800-618-3050.
Thank you guys so much. Information, of course, really good information that we'll have on our website shortly after the show. The company's name is Cardax. The product is Xanthicin. The guy who's running the show is David and Randal. Thank you so much for joining us.
Great to be here. Thank you.
Thank you, John.
Thanks to them for talking about it. We have information about inflammation, and it's connected to so many different things. So nice to know about it, different options that they have. Technology is always changing, and to know you have a dietary supplement that can help with that. I was going to say, you're looking swollen, but that's because of working out. That's not inflammation, is it, Mikey?
It may be a little inflammation. It may be a little sugar. It might be a little wine. I need to take some Xanthicin. But you know what I really appreciate is that they did their research. They said they went to a lot of fairs, and they even went nationally to really understand the product and the needs of people. So that's pretty awesome.
Exactly. Again, we'll post all the contact info on our website, khon2.com, and we always put everything on the show that you see here online.
Okay, so we're going to advance forward, and let's cross our fingers.
Here's something that you may not know. It's a connection between inflammation and serious health issues, including cancer and diabetes.
We talked with Cardax Inc, a biotech company.
I think that's where we ran into the trouble. So let's see, where should we advance?
Here's something that you may not know.
There you go.
Here's something that you
go ahead and back it up like you just did. Go ahead and stop your video.
So I'll stop the share, right? And then I'll come back in.
And come back in and scroll down and start. I'll show you. Okay. Bear with us. Technical difficulties. Welcome to Zoom virtual. This is how the pandemic goes here. Can you stop the slideshow?
Yeah.
And get back to just your slides.
Okay.
And then what you're going to do is click on the slide that you want to go to and start from current slide.
Here's something.
Well, so you're not showing us anything at this point. So
here's something that you may not know.
Let's see. I may need to get back here. Okay. Well, let's see if we can go this way. Nope.
So, yeah, close it so you don't, just.
Okay.
Okay.
Let's bypass that, and we'll start on this. How's that?
Okay.
Can you see
we
this?
don't see your slideshow though. You're going to have to share your screen.
Okay. Let's see. I'm going to share my screen now. Can you see this now?
Yep. So now scroll down to the slide you want to start with.
And
So that one, and then play from current. Yep. Play from current slide. See the second from the left says,
Yeah, that one.
yeah, play from current slide. There you go. You're on.
Hey, Zoom 101. Thank you very much.
Welcome back.
That's why we have an IT guy. So with that, for all of you, and thank you very much for being very patient during this trial. We're going to be giving out prizes actually, and the prizes will be a 60 capsule bottle of Xanthocin 3 times within this presentation. I'll have a question for you after Dr. Ruckles' presentation. And then I'll have 2 other questions at the end of my presentation. The way to answer is you would then go to the chat box and put your answers in there. And whoever is the first that does type in the correct answer, and Rick, you can be the monitor to this, and has the correct answers, will get that bottle of Xanthocin, and then we can make the connections. I'll leave my information at the very end. So without further ado, I'd like to introduce again Dr. John Ruckle, who will provide you with the scientific and health piece of the presentation. So Dr. Ruckle, it's your stage.
Okay, thanks. Did you guys hear me okay? I'm not on mute? You're good?
I can hear you.
Okay, great. Okay, thanks. Okay, so you're looking at this photo and you see a guy standing on what's possibly a mountaintop, either sunrise or sunset. Can't tell what, can't tell where that is. Can't even tell who that is. Well, that actually is yours truly, and I should probably start with a slide that looks local. I'll tell you where this is in a minute, but I'm glad that you joined us, and I'm glad I have the chance to meet with you, and it gives me a chance to put on my Aloha shirt and put on my rubber slippers. I actually lived in Hawaii for 13 years. I mostly grew up on the West Coast, California and Oregon, and then Washington from '87 to 2000. My kids grew up here, and then I came to Hawaii, and I started a research unit there in Honolulu in 2000 and was there for a total of 13 years. And then kids started having grandkids, and well, they were their kids, they were my grandkids, and you just have to make the decision: do you see them once in a while or do you see them often? So I gave up tropical sunsets for the sake of time with the family, and I moved back to Tacoma. And you see Mount Rainier, and that virtual background, that's Mount Rainier over my shoulder. You might be able to tell where that is. But loved living in Hawaii. I love my time there, and I still feel local. I still maintain connection with my people there. And frankly, the thing that I miss the most is paddling outrigger canoe. I got into that after the first year or two. I paddled with the New Hope Canoe Club, and you paddled most of the year actually, and have the training, and then the regatta season, and the distance season, and you build up to Molokai. I paddled Molokai 9 times, and so you get to know the guys in your club pretty well, and I miss everybody. So those of you in the paddling community might know Sai Kalama, our head coach, and if you see him, tell him that Dr. John sends his best aloha. So that's kind of a little bit of a background. Go ahead to the next slide there, Randy, and I'll tell you where this picture was taken a little bit later on in the presentation. Well, actually, I'll tell you right now. That's actually Mount Kilimanjaro. So I was there just 3 months ago as of today. And this actually does relate to the topic that I'll be presenting to you, because that was a big part of my climb. So Kilimanjaro, that's the highest mountain in Africa. Start the climb at around midnight, and you climb up with a headlamp. Got to the crater rim there right at sunrise. That was the photo that I just took. And then you go around the edge of the crater, and you're at the very highest point, the Hulu Peak, 19,341 feet high. If you're wondering if the air is thin, the answer is yes, the air is thin at 19,000 feet. And you look at that and you say, oh, blue sky, sunshine, it must be nice. No, there was wind. It was bitter, bitter, bitter cold, even with all those layers on. So I was there with my guide for just a few minutes. We took some photos and started back down, but made it to the top. Slow climbing towards the top, but all the 30-year-olds that were climbing the same trail were moving about the same pace. So very, very thankful. By the way, I just turned 70. I mentioned that just to give you a little bit of a context here. So I'm just thankful to be able to do what I do. And that does relate to what we're talking about here. So go to the next slide, Randy. So physicians and healthcare and providers agree that managing inflammation is actually important. Now we think of inflammation, you all have experienced inflammation at some time, and there's pain, redness, swelling, that's like if you're out in the sun too much, you get sunburned, that's inflammation. If you exercise too hard and your muscles ache, that's inflammation. You overdo your joints, your knee hurts, that's inflammation. And inflammation is part of a lot of the diseases that we think of, arthritis, there's inflammatory bowel diseases and so on. But it's actually a lot, it's part of many different processes. And normally I give this talk to physicians, other healthcare professionals. I just want to make this a little bit more conversational here. But inflammation is as we have studied more about this, it's part of many processes that affect us and have to do with aging and have to do with well-being and have to do with quality of life. So we know a lot more about this now way than back when I was in medical school. So there's a much more information about the importance of managing inflammation. So next slide. So these are just an example of some of the things that talk about inflammation. Arthritis, back pain, diabetes, high blood pressure, high cholesterol, high triglycerides, heart disease, gout, tendinitis, memory loss, cognitive impairment, fatty liver, muscle wasting, low energy. All of those things are part of inflammation. And you see the x-ray there on the left side, get a foot injury and then people quit doing stuff that they ordinarily would do. And instead of working out and being buff and in shape, well, then they end up sitting there eating the guacamole and the chips, and they just lose the fitness and tone and the kind of person that you used to be or that you want to be, and you find out that everything just gets harder and harder. So this is just, all these are just examples of inflammation. Okay, next slide. So there's certain ways that we heat this with physical measures. You can do heat and ice. There's non-steroidal anti-inflammatory drugs like ibuprofen. There's steroids like prednisone. With strains and sprains, we can put ice on it and compression and rest it. Sometimes you give steroid injections. There's physical therapy measures. Sometimes for pain, people use opiates and so on. So those are physical things that your doctors may do, or a podiatrist may do. But all these, have limitations in terms of addressing the underlying issues, and most of those were just for musculoskeletal injuries. Okay, next slide. And this is kind of a complex slide. We don't need to talk about all of these things, but this just shows that there's a whole lot of things going on. An acute injury can trigger inflammation, overuse, overexercise, mechanical strain, and these things are worse if you have certain medical conditions. And then the right-hand side, you see a bunch of terms there. Those are medical terms for various chemicals in the body that get out of control when there's inflammation, and that causes reactions in the tissue and has a lot of effects on your body in many different ways. Notice there at the bottom that it basically causes pain. That's one of the main things that you notice from inflammation, although a lot of inflammation goes on that is at a low level and you don't necessarily feel pain. You don't feel pain if there's inflammation that's affecting your coronary arteries. You don't feel pain if it's affecting your liver and your triglycerides and your glucose control for diabetes. But there is certain kind of inflammation that does feel pain. There's other low levels of inflammation that's equally important that may not be painful. Next slide. So there's a lot more information about this, like I say, than what we used to have. There was a clinical trial called CANTOS that studied inflammation related to cardiovascular events or heart disease. And there was a large study. There were over 10,000 patients that were enrolled. And they gave a kind of a complicated and expensive intervention to reduce inflammation. And it turns out what that showed was that if they reduced inflammation, this was a pure anti-inflammatory. It didn't affect blood pressure. It didn't affect sugar control. It didn't affect cholesterol. Didn't affect triglycerides. It just reduced inflammation. They found out that if they reduced inflammation, that they reduced heart attacks and the risk of heart attacks and strokes. Next slide. There's another example with a different drug. Again, this enrolled over 8,000 patients. And even though it was a different product and different mechanism, the common pathway was the same. They reduced inflammation. This was the low-level inflammation that goes on in your arteries and also affects your liver and other organs to a certain extent. And they found out that if they reduced inflammation, that they reduced the risk of heart attacks and strokes. So is well-controlled, double-blind, placebo-controlled, multi-center, prospective. I mean, all the gold standard things that scientists and physicians look at for being a good clinical trial, and with different mechanisms, but with the same common pathway. It showed if you reduce inflammation, you reduce the risk of heart disease. So very important findings and corroborated by both of those studies with different mechanisms. Next slide. So as a result of the CANTO study, and this was published about 4 years ago now, and the response of the medical community was everybody is going to be looking for anti-inflammatory therapies. I mean, they're coming through medical school, it says, well, if you want to reduce the risk of heart attacks, you control the diabetes, you control the high blood pressure, tell people to stop smoking or whatever you do to get them to stop smoking, you lower the cholesterol, you do these things, and that's how you lower heart disease. And those things are helpful. But it turns out that lowering inflammation is actually just as important. And so as a result of these studies, well, then it turns out there's a lot of interest in looking for something that reduces inflammation. Okay, next slide. So what do we do? What do we do? What do we do? What do we use to lower inflammation? Well, there's some products there that you see in front of you here are these things that we can rely on as friends, as allies to reduce inflammation. And you see Advil or ibuprofen, there's a generic ibuprofen and a number of other brand names. Aspirin, Bayer aspirin's the best known brand, of course. Celebrex, often used for arthritis. Tylenol people use for pain of many kinds. Prednisone and other steroids have long been used for certain kinds of inflammation, especially rheumatoid arthritis or severe asthma or ulcerative colitis or Crohn's disease or conditions like that. So are these things that we can count on? Well, those are widely used and they have a place, but they all have some potential problems. We can go on to the next slide. And this shows some of the things. They all have side effects. I mean, I'm not telling you these are bad products, because they're not, but they're not entirely safe either. They do have toxicities that we don't generally talk about. The ibuprofen actually can increase the risk of heart attacks with high dose long-term use. And aspirin can cause GI bleeds, that's well known. Celebrex is associated with increased risk of strokes. Tylenol can cause liver damage. Prednisone reduces the immune system responsiveness and reduces blood sugar control and raises blood pressure and can lead to a host of other effects with longer term use, especially the higher doses. So none of these are safe for chronic use, actually safe for chronic use, especially at more than low doses. At low doses for short periods of time, yes, they have a place, but are you going to use them long term? Well, they're really not the ideal agents. So this just summarizes some of the things we just talked about. These are all things in the FDA labels, and they're things that physicians know about, and they may or may not talk about. But some of you might have had some of these possible side effects. Certainly the GI irritation and the stomach bleeds from aspirin and ibuprofen. It can raise blood pressure, can cause changes in the liver function test, and so on. And if you take prednisone, well, again, if there's long-term use, well, then you've probably had some side effects from that. So a lot of technical things here, but the point is they do have some risks. People don't generally talk about it because you can get some of these over the counter, but people can die from an overdose of aspirin. People can die from an overdose of Tylenol. So low doses, well, then they certainly have a place, but they're not entirely safe. In the next slide. So what are we going to do? I mean, the fact that we're here talking to you suggests that we have a better suggestion. But until recently, we really didn't have a better alternative. That's why we used all of those products. So the next slide. So now we do, and that's what we're here to tell you about. It's astaxanthin. This is actually is a safe anti-inflammatory, and it's compatible and it promotes health and longevity. And you see those little diagrams there that actually shows what it looks like chemically. So what is astaxanthin? Well, some of you will know what it is. So this slide, this was in the introductory video. This is a product that occurs in nature. It's made by microalgae in the ocean, and then it goes up through the food chain that's consumed by krill, and then by shrimp and lobsters, and then small fish, then larger fish. We mainly associate it with salmon, lobsters and crab. You think of crab being kind of an orange or pink color, and you think that's the natural color. That's actually only because of astaxanthin. We think of salmon as being pink. In fact, the word salmon pink is a kind of a common descriptor. Well, they're only that color because of astaxanthin. We think of flamingos as being pink. Flamingos are naturally white. They're only pink because they get astaxanthin in their diet. So it's in the chemical class of carotenoids. Think of carrot, carotenoid, carrot. That's what they're related root terms there. Carrots are orange, and all the carotenoids, all the chemicals in that class have an orange, red, or pink kind of a color. They vary a little bit from one to the next, but they're all kind of deeply colored like that. And that is what helps support the animal with health and vitality. It's in nature to reduce oxidative stress and help the animals survive. And that's what's responsible for the colors in all of these animals that I mentioned. So you're familiar with this, even though you may not have known this was astaxanthin. Next slide. Living here in the Northwest, I always thought of salmon as just amazing fish that were strong and durable and had good memories, could swim upstream to spawn, and that's just kind of the way they were. I didn't realize that this was only because of astaxanthin, because you take the astaxanthin out of their diet, and salmon aren't a bright, healthy, delicious looking pink. They're gray, they're small, they don't reproduce well, they're prone to infections. They're not strong enough to swim upstream to spawn. And I think, what? I thought that was just the way salmon were, but no, that's only because of astaxanthin. So think about how remarkable it is and the strength and endurance it takes to swim upstream, for miles. And that's all because of astaxanthin. You think, I wonder what that could do for me. Next slide. So here's a picture of it. You see that pile? That's what a pile of astaxanthin looks like. Note that color. It looks kind of like a salmon pink. And there's that little diagram at the top. That's what it looks like chemistry. And astaxanthin is safe. We're talking about as being safe. And that this is an amazing thing to me because there's no significant side effects in the published human studies of astaxanthin or even the animal studies with this astaxanthin. I'll expand on that a little bit more in just a moment. This has a status of recognition by the FDA called generally recognized as safe. We just abbreviated it as GRAS or GRAS, generally recognized as safe. And what that means is that this can be used widely in as food additives or as a nutritional supplement, and there's no toxicities or dangers or side effects or any problems that would be associated with its use. And it takes quite a bit of work for the FDA to consider something as GRAS. There's been extensive safety testing, not only by Cardax, but by other companies that want to offer astaxanthin supplements. And there's a long history of use in humans and animals. And of course, people have been eating astaxanthin in their diet for as long as there have been people and salmon, or people and lobsters, or shellfish, or crabs, or all the other natural sources. So all of you, I expect, unless you have a really strict vegan diet, you've probably had astaxanthin along life's way. Next slide. this is what I was talking about, this astaxanthin safety. And I'll drill down for a moment on this. It looks kind of technical there, but bear with me for just a moment, because you remember my background. I'm a physician that's done clinical pharmacology research, over 350 studies, what they call phase 1. Those are the early studies, the very first studies. If a company develops a compound, they think it does wonderful things, and they want it to be approved by the FDA for use to treat diabetes or high blood pressure or arthritis or strokes or seizures or psoriasis or whatever. They have to go through a process. They go through animal testing. They start low dose, higher dose, higher dose, higher dose, longer periods of time. And they find a dose that's safe. And then they start with a fraction of that dose in people. They start with a low dose, then they build higher and then longer. And then when they understand the safety profile, then they take it on into later clinical studies to see if it's effective. Well, in all of these studies that I've done, and this is the world that I live in, well, then every compound that I've ever studied, at some level, there are dangerous effects in the animals. It can be mice, rats, dogs, monkeys, whatever animal, rabbits, whatever they're studying. When they get to high doses for long periods of time, something happens. There's damage to the liver or the kidneys or the adrenal gland or the reproductive organs or the eye or something. They always find something where there's some damage that this compound will cause. Like I say, even things that we think of as safe, like aspirin and Tylenol, you give enough of that to lab animals and they die. So and with astaxanthin, that's just not the case. They've given massive amounts of this for long periods of time to multiple different species. And what happens? Well, their muscles and their tissues turn salmon pink because the astaxanthin gets taken up there, just like the flamingo's feathers turn pink, and the shells of the crab and the lobster turn pink, and the muscles of the salmon turn pink. Well, you give this to a dog for a long period of time, the dog's muscles turn salmon pink color. And if what they don't absorb just goes on downstream, and so their stools will look, kind of a yellowish color. So, but when they look at the animals, there's nothing bad that happens. And this is really the only compound that I've studied in 25 plus years as a research scientist with hundreds of compounds. But this is the only one where there's no toxic level, no matter how much they've given to how many different kinds of animals. And to me, that's amazing. To me, that really says something. So, okay, next slide. But that's why we can say this is a safe anti-inflammatory, because it is. And it also works. There's over 2,000 reviewed papers that have been published, over 50 human clinical trials. A number of these were double-blind, prospective, placebo-controlled, randomized, et cetera. In other words, the more scientifically valid studies. Some of them were fairly small, others were quite large, but there's a substantial body of literature about astaxanthin that's in the scientific press. And it all shows potent anti-inflammatory activity, potent antioxidant activity, and then effects on various things that they're studying. Now, let me back up a little bit. I said that astaxanthin has FDA GRAS, G-R-A-S designation. It's still considered a nutraceutical or dietary supplement. It's not FDA approved as an indication for the treatment of diabetes, high triglycerides, high cholesterol, high blood pressure, arthritis, et cetera, et cetera. I mean, to get an FDA approval as an indication and make claims, and that's a legal term, to make healthcare claims for treatment is something that requires FDA approval, and that's a long, expensive process that I'm very familiar with. But that's different than being designated as GRAS. So we aren't making healthcare claims, but we can talk. It's legal to talk about structure and function. What does the literature show? What do scientific studies show are the benefits of astaxanthin, and what do people describe to us from their use? And it's perfectly legitimate to talk about the structure and the function. So that's what I'll be doing here. Okay, next slide. So here's one example of how astaxanthin is a very potent anti-inflammatory. Steroids, prednisone, prednisolone, are some of the most potent anti-inflammatories that are used in medicine. And this is an example of a study that was given, or even low doses, 1 milligram, 10 milligram, 100 milligrams per kilogram of astaxanthin was compared with the prednisolone at 10 milligrams per kilogram. And even the low doses of astaxanthin lowered inflammation. In this case, they're using TNF alpha, which is a small molecule your body makes as part of the inflammatory process. Astaxanthin was just as potent as the most potent steroid for reducing inflammation, which to me was pretty powerful. It's not that this is just safe, but it actually has a major effect when you look at this biochemically. Next slide. And then this is just a collection of data, again, show the same thing when we're looking at joint health studies for various types of arthritis. Well, we mentioned that these are in human clinical trials. TNF alpha is reduced. The C-reactive protein, another marker of inflammation, was substantially reduced. The adiponectin was increased. That's good. That actually has a positive effect in terms of cholesterol control. Oxidative stress, and they looked at this with numbers of different chemical markers. Everything they looked at showed that there was less oxidative stress. And that was borne out in the animal studies. Well, there are hundreds of animal models that look at these same kinds of things. They have different ways of inducing arthritis or oxidative stress and inflammation in animals. And when they gave astaxanthin, well, then it had a marked reduction in the inflammation and in all of those studies. So a lot of data that demonstrates this point. Next slide. So come back to our guy on the left. Those of you that look at the Heroes of the Universe movies will recognize these figures. Something happens, maybe you're exercising, you're buff, you're out there, you're running, you're cycling, you're swimming, you're paddling, you're lifting, you're just living your best life. Something happens, you have a setback, and then you get discouraged, and then you quit. And then the wheels fall off and you get worse and worse. You put on more weight and then you get out of shape, and it's just so hard to get back into the program again. Well, turns out if you want to get back to your usual self, like you used to be, well, then astaxanthin actually improves exercise, improves recovery, it improves endurance, it improves performance, and it helps you kind of get back with the program. It's not going to turn you into a superhero all by itself. Taking the supplement by itself isn't going to turn you into a superhero. Sorry. I wish it was that easy. But it will at least help reduce the stiffness and the soreness, and you will get benefits faster, and it'll be more encouraging, for you to kind of get back with a program. You can all relate to this, can't you? I mean, hey, everybody that there's a time in your life when you're doing pretty well, you're pretty active, you're feeling pretty good, and then whether it's an injury or just you get distracted and just kind of lay off of it for a while, it's around the holidays or something, and then it's hard to get back with it again, isn't it? I think we can all relate to that. Well, astaxanthin will help you get back with the program. Okay, next slide. And we actually did a study ourselves. I say this because this was Cardax Inc. Did this study right there in Hawaii. It was done at a doctor's office over in Kaneohe. We call this the CHASE study. All these studies have to have some acronym, yeah? Cardiovascular Health Astaxanthin Supplement Evaluation, the CHASE study. So we plan to enroll up to 120 men and women 18 to 75 with either heart disease or 3 of 6 risk factors, meaning diabetes, high blood pressure, high cholesterol, smokers, obese, or people that were just simply guys that were over 55 or women that were over 65. And then a C-reactive protein, that marker of inflammation, that was greater than 2. That just shows they do have some inflammation as well. We randomized people for 12 weeks, double-blind, placebo-controlled. Low dose was 1 capsule twice a day. High dose is 4 capsules twice a day, and placebo twice a day. And then after the 12 weeks, well, then there was open label extension extension where people would take the 1 capsule twice a day for up to 48 weeks. And we wanted to see what's going to happen. Do we reduce inflammation? Is it safe? Is it tolerable? Does it have any effect on their cholesterol and triglycerides? Does it have an effect on blood pressure? Does it affect their diabetes control? Does it reduce the inflammatory markers and so on? So we wanted to look at all those things. So go ahead to the next slide. By the way, we had to stop enrollment because of COVID. We didn't get all the way to 120, but we did an interim analysis with the first 40 subjects that did complete. So I'll go ahead and just kind of click on through these, Randy, as I speak here, because we did, this has the features that I mentioned, the randomized double-blind placebo-controlled, and we gave the Xanthicin supplement, the same product that you can buy over the counter. And for the 12 weeks of the open label extension, or excuse me, the 12 weeks, we analyzed it after that where we could compare the placebo and the high and the low dose. And what happened? It did all the things that we're just talking about. The CRP, the markers of inflammation, was down markedly. The LDL cholesterol, which is the bad part that contributes to heart disease, that went down in both treatment groups. It went up in the placebo group. The total cholesterol went down in the treatment groups. It went up in the placebo group. The triglycerides went down in the treatment groups, and it went up in the placebo group. The oxidized LDL, which is the part that is the most active at forming atherosclerosis, the hardening of their arteries, had a nice reduction in the high dose group, and it went up in the placebo group. Blood pressure was down in both treatment groups, and it went up in the placebo group. So again, this is a double-blind, randomized, placebo-controlled. So I think it shows that that this product has a real effect. Both even the low dose does some good. The high dose has even more benefits for certain things, so that validates what we see in all the non-clinical studies with the different animal models, and that these are consistent with all of those other studies that I talked about that have been published out there in the literature. So we were very, very, very pleased and impressed and encouraged that product had the results, and very safe. I mean, there were no significant side effects. There were no safety issues that came up in any of the groups. Next slide. So there are, just kind of getting to the point of summarizing here, recapping a little bit, inflammation and oxidative stress is a common component of a lot of different medical conditions: cardiovascular health, heart disease and strokes, metabolic health with diabetes and high cholesterol, liver health, particularly fatty liver, joint health with arthritis of all kinds, actually, the osteoarthritis, the wear and tear arthritis, and rheumatoid arthritis, and the other inflammatory arthritis. Longevity, and astaxanthin is helpful for promoting longevity. And mental health, we didn't assess it in the CHASE study, that wasn't our objective, but there's a lot of information that cognitive impairment is due to inflammation at low level, chronic level in the brain. And reducing inflammation will help preserve cognitive function for much longer. So throughout the body, many places that you look at it, well, then reducing inflammation is consistent with good health and longevity. Next slide. So just kind of several bullet points here. Again, many common medical conditions and reducing inflammation. We have these markers, interleukin-1 beta, interleukin-6, C-reactive protein, and others. Reducing that, we can measure these things in the bloodstream. And we show that when we reduce these things that we can measure, that reduces pain, it promotes healing. The optimal intervention is safe, convenient, cost-effective, and compatible with other treatments. You don't want something that means you can't take it with whatever you're taking for high blood pressure or diabetes, et cetera. You want something you can add to the things that your doctor recommends for you already. And we found that astaxanthin, in our experience, as well as in the literature, it's a safe anti-inflammatory with broad application benefiting cardiovascular health, high blood pressure, diabetes, hyperlipidemia, that is high cholesterol, high triglycerides, osteoarthritis, liver health, skin health, CNS health, and more. Skin health. I mean, yeah, you live in Hawaii. I mean, you're out there in the sun. I mean, you can put on a sunscreen. You can, use things to protect your skin from exposure. Actually, astaxanthin will help prevent the inflammation. If you do have sun exposure, it helps prevent the inflammation. I can notice a difference if I have sun exposure with and without it. That hey, I'm a haole. I mean, I turn pink when I get out in the sun. I start hurting, and with astaxanthin, well, then I don't have nearly as much of that effect. So I could, that's one of the things that I can tell, right away. Slide. So that actually leads me to my personal testimonial, and you might think, and so Dr. John, if this stuff is so good, do you actually take it? And the answer is yes. Yes, I do. Yes, I do. I've been taking Xanthicin ever since it first came out. It's been out about 5 years now. And so these pictures here, these obviously are from Washington State. They're not from Hawaii. That picture on the left was of me summiting Mount Rainier. And the one next to that is Mount Adams, and then Mount Baker, Mount Hood, Glacier Peak, and Mount St. Helens. That's the other. That's not a photo of that here, but I got the others. So these are all the 5 major glaciated peaks here in Washington, plus Mount Hood in Oregon. And I climbed all those when I was 65 years old. And I was taking astaxanthin, and I'm convinced that it made a huge difference. I was the old dog on the climb team. I was the other people there in their 20s, 30s, a few in their 40s. And not only to make it to the top, but then to be able to keep up with the rest of the team. I was just very pleased that I could do that, and to feel good doing so. I was just very thankful that that was the case. And I'm certain that the astaxanthin had a lot to do with that. And the next slide. So that was the mountaineering, and then it's not just that. Yeah, that upper. I run. I started running. I ran a little bit when I was in my 20s, but I didn't do any distance running until I was in Hawaii. Actually, my first marathon was the Honolulu Marathon when I was 50 years old. But I continued to run after I came back here to the mainland, and I found that I just felt a lot better down the last 6 miles if I was taking astaxanthin. That middle picture there is of me in Patagonia. I went to the southern tip of Chile. I went trucking there on what they call the O Loop, 90 plus miles. Just an absolutely fantastic time. I love that. And the picture right below that was, they say the Patagonia was 2 years ago. The picture below that was last year. I was trucking on the South Island of New Zealand. By the way, you notice I'm still wearing my New Hope Canoe Club shirt. That was a coincidence I had in both of those pictures. I still wear that. It makes me feel connected to the islands. I had that on. That was one of my layers up at the top of Mount Kilimanjaro. So I ski, I run. The other photos there, they've got marathons or half marathons that I've run. And I'm just thankful that I can be active, and I can go on adventures, and I can enjoy life. Like I mentioned, I just turned 70, just climbed Mount Kilimanjaro. Just looking forward for adventures still to come. And I plan on taking astaxanthin. That will be, I plan on taking that, for life. Actually, there may be some questions we can kind of come back to later. I'm happy to talk about that some more. If you want to talk story about how this has worked for me, or the doses that I take, or how I use it, well, then I'm happy to do that. But I want to give Randy some time here. So Randy is gonna pick up at this point, talk a little bit more about astaxanthin and longevity, and then a little bit more about the product.
Can we ask a little bit of some of the questions that are here first? Would that be okay, Randy?
Sure, that's fine.
Okay, because they're kind of, yeah.
Rick, okay, if we take this break, but I wanted to give out a prize.
All right, go with that first.
Yeah, so I do have a question for the audience, and again, hopefully you took some copious notes, and you can put your answers into the chat box, and Rick, you can probably look to see who came in first and if they have the correct answer. And so that question is, what is astaxanthin? What is astaxanthin?
Put that in the chat box.
In the chat.
First one to reply with the correct answer gets what? What are we winning?
They will receive a 60 capsule bottle of Xanthicin, which runs $39.99. Actually, in the GNC stores, on our websites, in pharmacies, and so on.
All right. So what is astaxanthin? I can't even say it.
Astaxanthin.
Can I say it better if I take it? Let's see. So the first one that answered, hold it, we got all kinds of answers here.
You have a
How many-
time?
Well, let me go back to the very beginning here. Let's see here. So Elizabeth says anti-inflammatory, algae.
That's good. That will count. That will count.
Okay.
Oh,
And-
Randy, you should be generous. The other people that typed in correct answers, you should send them a bottle as well.
So Deborah Willis said pink stuff in salmon and shellfish.
And we're-
Sheldon Nagata says an anti-inflammatory supplement. And Naomi says carotenoid.
We have
We'll
several correct
include
answers.
those three. We'll include those three then. Okay. Okay.
right.
So
Oh, one more. And then Joshi says antioxidants.
that could qualify as
That'll
well.
count. That'll count.
Okay.
So why don't we, I'll, at the very end, have my information. Please take my email address, phone number, and we can connect from there.
And Brad says it's a natural molecule produced by krill.
Yeah, I'll give them points for that.
Yeah? Okay. How many you gonna give away?
Well, that's actually produced
Yeah,
by
I think
microalgae, but that's
we're out of
okay.
memory, Greg.
That's
All
okay.
right. So Randy, if you do not, well, we'll talk about this afterwards. Don't go away at the end. I'll show you how to actually save the chat so you know who answered what. Okay.
So why don't so that we can be cognizant of people's time, that I can make sure we get through this information, and then we can open it up for all these questions.
All right.
I'll step forward, but again, thank you very much for your time, for joining us, Dr. Ruckles, for that great enlightening information. And what we tried to do is we tried to make it consumer friendly on the scientific portion of our presentations. This way, the consumers can get a better understanding, put their arms around what we are trying to present in way of the science. But this is something that intrigued me. And again, I mentioned that I spent almost 2 decades in the pharmaceutical industry and another 10 in the medical field as well. And for me to look at a supplement, this was intriguing to me because, working with Pfizer, bugs and drugs, pharmaceuticals were the only way to approach medical needs. And so when I looked at this compound, I says, well, it took me about maybe 3 months before I decided to get involved, because I wanted to do my due diligence. And for me, coming from the pharmaceutical industry, I thought, how can a supplement equate to that of a pharmaceutical drug? So I spoke with their scientists. I brought 10 of my physician confidant advisory friends to a meeting with the CEO, COO. We ripped the science apart, and they all came back to me and they says, Randy, this is really meeting an unmet patient need, that we have a very potent, very safe anti-inflammatory for joint health, cardiovascular health, metabolic health, liver health, brain health. This would be a great opportunity, and this is addressing this unmet patient need that we have. This will be huge. So from there, I spent a little more time doing my own due diligence, and this is where I gravitated to now, doing the work with Cardax, and not only bringing it into Hawaii, but bring it to the rest of the nation, bringing this to globally, because we feel we do not have a Me Too product. We call that Me Too in the pharmaceutical industry. It's truly more intriguing. It's a game changer, a supplement that can rival some of these prescriptive products on the market today in a very safe in a very safe venue. So 5 years ago, we brought this to market. I helped bring this to launch to Hawaii. And it was shortly thereafter, I should say, we brought it to market. It then became the #1 selling product in all the GNC stores in Hawaii. GNC was the only retail brick and mortar chain that we brought this to, and we still have it with them. But if quickly became the #1 selling product in all of the GNC stores in Hawaii. So 4 months later, GNC Corporate reached out to us and says, wow, we've never seen sales like this in the history of all of our SKUs or products. When can you come to the rest of the United States? So that's when we says, well, give us about 4 months so that we can ramp up manufacturing. And with that, we can get into the almost 3,000 GNC stores. So we are in now nationwide in the GNC stores. We are not currently the #1 selling product in the GNC Hawaii stores due to COVID-19. Many people, I mean, they were shutting down their store hours. Many people were really trying to gravitate heavily into immune products and so on, of which, you know, Xanthocin as well works towards, but they were, you know, grabbing all these immune health products. So with that, we launched 5 years ago. Now we're into all the 3,100 GNC stores. And then a discovery was made by the University of Hawaii. They took our compound, and what they found was that it was extending the lifespan of these animal models with our product, with our compound. And so what we're finding is that this research has been replicated in 20 independent studies, and it confers that there is cardiovascular protective benefits by reducing what Dr. Ruckles mentioned, reduction of CRP, TNF-alpha as an example. It's this activation of anti-inflammatory, anti-aging gene. It's called the FOXO3 gene. We all have this gene, but only 1/3 of us has that right version, or we call it allele, to live 90 to 100 healthy. So you might see these healthy elderly kapuna out there, and you can say, okay, 1, 2, 3, you have that right allele gene. 1, 2, 3, you have that right version or allele of the gene to live that 90 to 100 healthy. Well, what this discovery and finding is now sitting with the NIH, which is the National Institute of Health. They're furthering research and studying on our compound to see how this is affecting longevity and the increase of lifespan with animal models, and then taking this proof of concept that we can take to humans. And so what the underlying mechanism of action is that this astaxanthin compound is activating that gene that we all have called the FOXO3 gene, so that we too could have the potential of that longevity of life and lifespan. So that was a real aha moment for the anti-aging physicians or doctors, the longevity doctors, and we got recognition this way globally as well. So I'm going to move to the next slide, which will talk about the news, the TV news stations on KHON TV, channel KITV, and even KGMB. The news channels covered this announcement made.
Extending human life. That possibilities next on KITV Island News at 6.
The scientists at UH Medical School say they're closer than ever before to developing an anti-aging supplement.
I think the concept that there is anything that we can do to improve human lifespan and health span is a breakthrough.
The scientific recipe to living longer could be within reach. This morning, the University of Hawaii John A. Burns School of Medicine announced it is closer than ever to understanding how human life can be extended. Moani Kiela Nabarro reports from Kaka'ako.
Scientists at UH believe they've cracked the code as to why some live longer than others. Tests on worms and mice inside this UH medical lab unveiled anti-aging benefits of a gene called FOXO3. Everyone has the gene, but research shows people that live well into their 90s have a certain form of it.
It's equivalent to not smoking a pack of cigarettes a day for 25 years. That's not powerful.
Scientists say they've discovered how to stimulate the life-giving form of the gene.
What we've shown is that we have a compound that actually activates FOXO3. So we've connected some dots that didn't exist before.
That compound is astaxanthin. It's an ingredient already found in supplements on store shelves. The latest research supports its critical role in health. Scientists are now looking for funding for clinical trials. That's where they say they'll continue research on how to alleviate inflammation in the body that could be connected to heart disease and even cancer.
All of these diseases seem to be tied into the building of this chronic inflammation. So if you can find a way to reduce the chronic inflammation to combat that, then you can sort of tackle all of these age-related diseases at the same time.
Scientists say if testing goes well, we could be about 5 years away from seeing a newly formulated supplement. Moanike Navarro, KITV Island News.
So again, that was something that we never anticipated. We did not even have an idea of pursuing this. But Dr. Bradley Wilcox from the University of Hawaii Medical School Research Center had mentioned that through this research, we have shown that astaxanthin actually activates this FOXO3 gene, which will promote longevity. And so with that, it has been brought to our attention that there has been numerous of specialty of physicians reaching out to us, especially the anti-aging, naturopathic, functional medicine type physicians, as this is part of their specialty as well. So for us, Cardax, as I mentioned, embarked on this journey probably about 20 years now, 20 years ago, to come out with this synthesized astaxanthin compound. And not all astaxanthin, there's other astaxanthin products on the market, and you could probably see that either on Google or in the stores, but not all astaxanthin products are created equal. They're very different. We're the only synthesized astaxanthin compound or product on the market. And I'll explain the reason for why we chose this direction. How we came upon the name xanthocin is taking the xanthophyll, and that's something that I think John may have shared with you. That's the carotenoid, and then syn, meaning synthesized. And we term it as a safe anti-inflammatory for health and longevity. As Dr. Ruckles mentioned, that we cannot state any kind of disease state claims whenever we advertise xanthocin. It is a supplement. So this is where we have to always use the terms for health or for support. And we would really want all the other supplements in the market follow that same FDA binding criteria and regulations, but many don't. Many will flirt over the boundaries and make disease state claims. But we ask you to be very thoughtful about it and to be wary of the advertising that supplements might be doing these days. We are very confident and we are very supportive by saying that xanthocin is the first physician-friendly astaxanthin. You saw by the photos in the Living 808 video interview of all those medical conferences that Dr. Ruckles and I would be doing. In fact, I think in about a year and a half, we had probably presented to about 18 continuing medical education conferences, some non. We presented at the Straub Medical Center. We presented at Polimomi Medical Center. For all the doctors there, we presented at the Filipino Medical Association as well. We've presented to dentists. We presented to primary care physician groups and so on. So we can confidently say we are the first, maybe only physician-friendly astaxanthin product on the market. As you can see, there's two bottle sizes here. The white labeled bottle is a 60 capsule bottle, and the blue label bottle is a 30 capsule bottle. But we no longer are offering the 30 capsule bottles. Reason being is that overwhelmingly, we were being approached that we should come out with even a bigger bottle size because they were coming back so frequently, they didn't want to have to keep coming back. We now offer a 90 capsule bottle size. The 60 capsule bottle size runs $39.99, and the 90 capsule bottles run at $59.99. So as I keep saying, Xanthocin, or this Astaxanthin product, Xanthocin, is not a me too. It's truly unique. It's a game changer in way that we provided some support material through our studies. One of these studies was called a fixed sequence multi-period open label crossover study. So what we did was, and I'll summarize, we measured the blood levels. When you take Xanthocin, we measured the blood levels to see how much of that astaxanthin or Xanthocin is in your body. And we also studied the safety and the tolerability, recorded that as well. So we took the leading astaxanthin product on the market, the number one, okay? And what we did was we provided these 5 healthy individuals dosing of Xanthocin, 12 milligram capsules, 2 times a day. So 24 milligrams, or I should say 2 capsules, 12 milligrams, 24 milligrams. And again, under fed conditions, because it needs to be taken with a meal that has a little fat. We call it lipophilic, meaning it disperses, it distributes into the fat as it travels into the blood and into your tissues. So these 5 healthy individuals were given Xanthocin. Then we took their vital blood draws, and we took these measurements at 0 hours, 3 hours, 6 hours, 9 hours, 12 hours, and 24 hours. Then we washed them out. We had them take a pause for 7 days. Then we brought them back, and then we had them, same thing, take the leading astaxanthin product on the market, 12 milligrams, 2 capsules, 24 milligrams, under fed conditions as well, and measured their blood and did the blood draws and measured their PK levels at 0 hours, 3 hours, 6 hours, 9 hours, 12 hours. And this was the findings. As you can see in the blue bar graph, Xanthocin is in the blue, the gray is at leading we call it microalgal extract because, as Dr. Ruckles mentioned, it's algae that's releasing that compound which the salmon, krill, and all that will consume. So we took that leading microalgal extract and we measured it at 0 hours, 3 hours, 6 hours, 9 hours, 12 hours, 24 hours. And you could see, and on the left side in the shaded blue, this is where pharmacists really get deep in looking at and comparing products. And this is something where you can become mini pharmacists by looking at things like this. They call it average under the curve. It was 2.85 times greater than Xanthocin with absorption. The Cmax, which is max concentrations in the Xanthocin subjects, were 3 times greater. The coefficient of variation we call, that is the tightness of variability of how much of the PK levels in the patient's blood. With Xanthocin, the range fluctuated very tightly at 27%, where the leading astaxanthin product had a wide variety of ranges of 62%. We say the time to the max concentrations, meaning when you take the Xanthocin capsule, when does it reach the highest level in your body with the most of the levels in your body? And as you could see, 6 hours in the bar chart, you can see it where 6 hours is when Xanthocin has its highest level. Half-life, that means when you take Xanthocin, how long does it stay in your body before half of that dose is excreted or removed? And so that's where pharmacists will always want to know what is the time of max concentrations and what is a half-life when 50% of that drug, if you will, or that supplement will be eliminated out of your body. If in case the side effect were to take place, you kind of have a range. So like what we would say is not all astaxanthin products or compounds are created equal. In fact, if I can go back to this slide, not all astaxanthin products are created equal because you've got the microalgal extracts. That's one class, and then you have synthesized xanthocin or astaxanthin, which is xanthocin, which we're the only ones on the market. The big differences are as well that are seen is that there's a step process of development of the microalgal extracts. They're growing it in these outdoor vats as one of the stages. There could be outside external elements of pesticides, fertilizers, jet fuel, bird feeds. You don't know. And physicians really don't feel comfortable not knowing what is in that capsule that they're recommending you or prescribing you to take. That's the reason why we can't fault physicians, why they want it coming in a pharmaceutical rigor, because they want to know exactly what's in that capsule. They're responsible. They need to know what they're having you consume or take. So that's why we say it's not equal. Alongside with that, the bar graph or that study, that trial, that absorption trial showed that xanthocin had a 2.85 times greater bioavailability or absorption than the leading microalgal extract. And again, we say all astaxanthins, you want to take it with a meal that has a little fat in it. And the reason why we call it lipophilic, it distributes and disperses in the fat as it travels throughout your body, through the blood and through the tissues. Purity, precision and purity. It is CGMP. What that means, current good manufacturing practices. Xanthocin meets that rigor. We manufacture in Switzerland through a big pharma manufacturing plant, so it meets all that FDA rigor of purity, of sterilization, and so on. There's no aftertaste or smell, and I challenge you, take any other astaxanthin product, puncture it, and see what comes from that in the way of smell and the liquid that comes out. Generally recognized as safe is what Dr. Ruckles had also shared more on. And so with that, we say there is a definite difference between extraction or synthesized astaxanthin.
We're going to run out of time, Randy. Do you want some questions? We got 10 minutes left here.
10 minutes. I'll wrap this up in say 3 minutes, if it's okay. So with xanthocin, there's purity, there's precision, and there's pricing as well. As I move through this, Dr. Ruckles mentioned that, and of course, FDA GRAS. And these are not FDA GRAS designated. In fact, the CEO told me that if these products were to have come onto market today, they would not probably have been even approved. So the key benefits and information, xanthocin is FDA GRAS, generally recognized as safe. It meets current good manufacturing practices. It's gluten-free capsules. It's non-GMO, vegan. They're vegan capsules, pure and precise in its composition. No fishy smell or aftertaste, does not take away from the environment, and the naturopaths were very, very advocating of this with us. Side effects, if you do see anything, it could be a slight orangey, pink, reddish tint to your stew, but that's no different than drinking a lot of carrot juice or eating a lot of carrots or eating a lot of beets and so on. No drug interactions, does not inhibit the P450, we call it P450 cytochrome enzyme, the 2D63A4. Sometimes if you take grapefruit juice and you take a medication, it can, grapefruit juice will be looked at as a 3A4 inducer. It'll increase levels of concomitant medications and you could have greater side effects. So the labeling says 1 capsule per day, but what we say is with a meal with a little fat, it's lipophilic. But we say the sweet spot appears to be 2 to 4 capsules if you have, we say, any kind of issue. And I mentioned it's 60 capsule bottles, $39.99, 90 capsule bottles at $59.99. And real quick, these are the medical conferences that we present at. This was like at 7 in the morning in Arizona. These physicians show up to hear this breakthrough type information of a supplement. Normally they're not endorsing a supplements, but they stood in line actually after we presented the science, stood in line for their trial bottles. This is the nurse practitioners, same thing. They lined up after we presented the science, wanting to try this for themselves and their patients. This was with dentists. There were about 10,000 patients at this, dentists at this conference. We packed the room. They wanted to learn about this and use this in their practice. When I got through with the presentation, they lined up all the way around the corner. This was amazing. It was mind-blowing. This is the reception, and this is what we learned by the medical conference presentations, that these physicians are really excited and embracing of what we have, a supplement that has the efficacy of potency without the side effects. And this was Dr. Ruckles and I presenting at the physician assistants in California. I could not even get out to the table before they swarmed us wanting to have a trial of this. Lastly, this was all the doctors of osteopaths in San Diego, same thing. We packed the room up, and they too lined up wanting to have a trial of this. Where to purchase Xanthocin? As mentioned, online orders, you can call 1-800-618-3050 or xanthocin.com. It's in all the GNC retail stores in Hawaii, US, Guam, Newtown Square Pharmacy. They even do free deliveries of medications. Pharmacare Hawaii, and also IAEA Medical Pharmacy. So with that, thank you very much. On behalf of Dr. Ruckles, myself, and Cardax, we really appreciate your attention. And again, this is my information if you need to reach out to me, and I'll leave that on. So I have two quick questions, and this will be and this is the first. Rick, we'll just go with the first person that addresses it through chat, and that is, how do you take Xanthocin?
Well, I'll comment on that. Yeah, I take normally 2 capsules twice a day. I take it with a meal, or just shortly after a meal. Now, when I challenge myself, like for my Kilimanjaro climb, then I double that. I took 4 capsules twice a day. When I'm training for a marathon, I'll take 4 capsules twice a day. There's no toxic amount. The only downside is you go through the bottle faster. So if you start off with 1 or 2 capsules a day, that's fine. If you have something that you can tell, like a knee pain, or if you challenge yourself athletically and you want to take more, well, then it's okay. There are some people that take more than twice as much as I just described, and they do fine. So start with what's reasonable, and then you can go up from there if you need to.
So maybe we'll roll it out to Rick. You have questions from the audience.
So Jushi actually answered first that, and then the doctor actually, he actually wins the bottle though, huh?
Okay.
So I saved the chat. I will send it to you. So we do have, we got questions. We only got 5 minutes. I have to wrap up, so not much time here. So you say it's safe for children. Somebody's giving it to a 9-month-old for teething. Is that okay?
Sure, that's fine. Yeah, that's fine. You can mix it with, you can take the capsule apart and you can mix it with liquid, and it'll turn water or milk. It'll turn it kind of a pink color.
She's using it with milk. Okay. She's doing milk is what she's doing.
Right.
Well, so you already talked about other products and how your research compared to that. How about like muscle shell supplements? How does it compare to that?
Well, Rick, can I show it real quick? This is a bottle of water. This is a capsule. I'll show you. When I open it up, I'll pour it in, and people take it this way as well. People that have motility issues, they can't take their pill phobia or can't take swallowing pills. And look what happens when I open it up and I mix it with water. And everyone can do this as well. And they can see how quickly it will turn the color of shellfish and salmon. And we do this demonstration with all the physicians. We actually let the physicians try it themselves, and they can see how clean, no fishy smell. It's pure. And people drink this as well.
All right.
The main thing is that it's being synthesized. It's a pure chemical entity. This is nature identical. In other words, the actual compound is the same as you get from nature. But when we manufacture it, it's pure, and then we put it in a certain micro beadlet formulation that makes it absorb more easily. So those are the main differences.
Okay, Rick.
All right. So, man, we're gonna run out of time here. So, can they get it on Amazon or only through you guys?
Nope, they can go to Amazon, xanthocin.com, GNC stores, the Newtown Square Pharmacy, and PharmaCare.
All right. So I'm going to wrap up, guys. So this has been great. This has been very helpful. I know there's other questions that didn't get answered. You have Randal's information. You can email him or give him a call. He's happy to talk with you about the questions that we didn't actually get to here. So wonderful information. Thank you. Really appreciate it. I'm going to send you the chat box, which has the folks that answered your questions, Randal. So this will be uploaded onto our website. So generations808.com should be ready to go tomorrow. You're welcome to go in there and look at any of the webinars that are in there. So the Brown Bag lunch webinars are all stored there along with the radio shows as well, 2 separate files. Easy to find and easy to share as well. And you can watch them anytime or share them with anybody that you like. Our next webinar is going to be on June 16th. It's going to be body and brain. It's kind of a nice follow-up to this. So it's going to be about a little bit of movement and exercise, which is a perfect segue from this, I think. So wonderful. The next magazine is actually about ready to be printed. If you haven't got the latest edition that came out, please grab it. There's a lot of good articles in there, but you also can just look it up on the website. Every magazine is there, and the latest edition is actually the first that's there, but it's all archived. And just I'm sure most of you are familiar with Generations magazine, the web page, but you can actually just in the search engine put the keyword in that you're looking for, and everything related to it will come up. It's really pretty cool. So these guys will be in there. Cardax actually is in our magazine as well. So it's wonderful. So oh, and I see Doug just posted the link here to the Generations page as well for the website. So. Okay, so I appreciate everybody being here today, and I look forward to seeing you on the 3rd Wednesday next month. You know, I'm going to add one last piece. This year filled up with our partners and their presentations so fast that we're now going back around, and we're going to add the 1st Wednesday of the month real soon. We'll advertise that as soon as we get that scheduled. A lot of demand for these, so I'm really glad that the audience is here to watch these incredible presentations, and I really thank Randal Mao and Dr. John Ruckle for their time today. Very informative. Appreciate it. I'll have to get a bottle of this myself here. I'm an old sports person that's all kinked up. I got a sore ankle right now, guys, so we'll talk about that afterwards. All right, so appreciate it. Take care, everybody.
Thank you.
Mahalo.